Intussusceptions. Intussusception, by definition, is a condition in which a segment of the bowel is invaginated with an immediately adjacent distal portion. The proximal part is invariably inside the distal portion. What are the etiologies? Primary, that is idiopathic, or it could be secondary to infection like upper respiratory infection, gastroenteritis, UTI, around 30% of the case. Lead point, because diverticulum, polyp, ectopic pancreas, intragenous cyst, appendix, or tumor. Following surgery, it could be intrap or retroperitoneal. Addition is fecal bowel leakage edema acting as a lead point is cause of unexplained post of intestinal obstruction. Pathophysiology, most occurrences are acute. The imaginary segment of the septum is carried distally and by peristalsis, disordered peristalsis. Mesenteric vessels become involved with the intra-alveolar loop and are squeezed within the engulfing segment, that's in space. The pressure created by the walls of the intestine pressing together causes decreased blood supply, irritation, and swelling. Venous congestion is a major factor both in symptomatology and in the characteristic presence of blood in the stool. Types of intussusception. Ileocolic is a small intestine telescopes into the colon. This is the most common intussusception. Ileoilia, the small intestine telescopes into itself. Colocolic, the large intestine telescopes into itself. Ileoileal or colocolic intussusception occur less frequently than ileocolic intussusceptions. Intussusceptions has three parts: inner tube, enteric part, middle tube, returning part, and outer tube, that is intussusceptions. The presentations, there are classic triads: pain, a normal healthy child suddenly screams with pain and draws its leg up and may adopt a squatting position. Child appears normal after spasm. There's vomiting, bleeding perirectum, around 85% of the cases. Early symptoms can include nausea, vomiting, pulling legs to the chest area, intermittent, moderate to severe clumpy abdominal pain. Later signs include rectal bleeding, often with red crust, jelly, stool, the stool mixed with blood or mucus, and maybe patient lethargy. In children, those too young to communicate their symptoms verbally, they may cry, draw their legs up to the chest, and express dizziness with paroxysm of pain. Fever is not a symptom of intussusception. However, intussusception can cause the lobe of bowel to become necrotic. This leads to perforation and sepsis, which cause fever. In some patients, intussusception is a pale loss. The infant may appear pale, diaphoretic, or lethargic. Eventual signs of intestinal obstruction. Physical findings: mass, maybe abdominal examination, shaped curve, mesenteric attachment, so hard in consistency, located in the right hypochondrium and stretching across to the midline, might be tender. Right fossa feel lumpity, that's called a densine. Distal rectal examination, blood stained mucus, so apex may be felt. Diagnosis investigations, CBC and other investigations. Plain abdominal X-ray, which is not written, signs of intestinal obstruction, RMPT, right iliac fossa, soft tissue mass, Target sign, absence of fecal gas or stool, meniscus sign, loss of visualization, tip of the liver, paucity of the bowel gas. Ultrasound is diagnostic. In transverse hypoechoic outer rim and central echogenic core, that's called a deafness sign. Longitudinally, hyperechoic center, sandwich or pseudokidney sign. Accuracy around 100%. Contrast studies, barrier minima studies, it shows a close sign. Treatment: supportive management means GI drainage with energy decompression, IV fluids and referral replacement with crystalloids, maintenance like 4 to 1 rule per hour, ongoing load replacements. Definite management aims to relieve the obstruction. First portion by enema therapy, which is excellent result, with the X-ray exposure than the barium enema, early and quick and clean technique. Ultrasound guided saline enema therapy, no X-ray exposure, those procedures time not limited, excellent result, visualization all the components of the intussusceptions, is the recognition of lead points and residual intussusceptions. The large perforation rate, the last one, surgical means of reduction. Complications. Perforation is a serious complication due to risk of infection. If not treated, intussusception is almost always fatal for infants and young children in 2 to 5 days. Others like complications, pneumonia, sepsis, and stomach breakdown, recurrences, these are complications. Prognosis, the outcome is good with early treatment. There is risk the condition will become about 3% after reduction and up to 11% recurrence after non-operative reductions. This is about intussusception.